All right, everybody, we are going to go through a quick tutorial on how to use the Medicare.gov website. First, you're going to go to Medicare.gov. This website is going to be able to give you the full explanation of cost of medications as well as all the information that you can have. It's done by a third party, Medicare.gov. This is a place that your clients can go to, they can visit. It is an official government website, so it's not really going to lean towards a particular carrier. It's going to show third-party information that is going to show you costs of medications, best programs, overall expenses, and more. So we're going to go through it together. So the first thing that you're going to do is you're going to come to Medicare.gov and then you're going to hit Find Health and Drug Plans. After you click on Find Health and Drug Plans, you're going to be asked for a couple of questions. First thing is put in your zip code. So let's put in a zip code here. And then we are going to click Find Health Plans. Obviously, you're going to put in the zip code of your client to show available plans. We're going to come down here now for these questions here. You can just simply hit I don't know and I don't know. That way you can get base pricing. You can get all of the basic information as opposed to dealing with low-income subsidies or some other areas that are going to be of a concern, because you should address those concerns directly with your clients. Next thing you're going to do here is type in the drug list. This is what this website is all about. So what you're going to want to do is you're going to want to go through here and type in all of the drugs. Very important that when you're doing this that you get the list of the medications, because you are going to reference this after or at a later time. So let's just go through and let's go through a couple different medications. We're going to pick one and then it's going to show you the list of the medications. You would then pick the appropriate dosage and the timing of that. And once I select the dosage and how that they add that medication, it'll add that medication. If we would keep on adding a list, so if we went through, let's just see, metformin, just add in your drugs. Whatever the dosage may be, add drug and dosage. Now you may come up through a medication that is going to show up here, and I'm going to show you a little thing here. After we add the drug and dosage, if the drug is available in a lower cost generic medication, it's going to give you that right here. Please be mindful and select whatever the client is taking. Don't just right away click to the lower cost generic if they are not taking that. The reason that that's going to be important, because some of our medications that are going to be name brand may fall in a different tier, and you have to make sure that if they are taking the generic, you're addressing the generic or the name brand because of the drug tier. So we have those three, and let's just leave that there. Now, at this point in time, you are going to be assigned a few different pieces of information that you're going to want to be filling out on your Medicare worksheet that you use for your clients. That's going to be the drug list identification number, the password date, and the zip code. Now, the reason that information is going to be important, because you could always come back to the Medicare.gov website, enter in some of this information, and access the drug list of your client at that point in time. It's very important that you write that information down and keep it organized. After I have that information, it's going to follow me through the rest of the application, as you see here. And then what we can do is we're going to select the pharmacies that the client may use. So you'll ask them what are the best pharmacies that they like to use, and we could add those pharmacies. And after we add those pharmacies, they will show us the exact pricing at those chain pharmacies. Continue to plan results. What's going to happen is our next slide is going to show us some information of the different plan options that we have. We can be looking at prescription drug plans only, Medicare health plans with drug coverage, or without drug coverage. So you know Florida Blue does not offer any Medicare plans without drug coverage. All of our plans are going to be located in the health plans with drug coverage or the standalone prescription drug plan. For this demonstration, which will work the same if we were looking for a standalone prescription drug plan, we would just select the other option. After I have this information here, now I'm going to be given my original Medicare amounts, which we know those are standard. I can do a sort here and sort my results by any number. Let's just do plan name, and then we click on sort. So as we sort by plan name for this particular area, we will come down until we find our Florida Blue programs. So as we can see here, we have our Florida Blue Lifetime. We have our Florida Blue Prime Time. Now on the screen, it's going to show me annual drug cost amount, and you can see that $859 there. You can also see monthly premiums, deductibles, health benefits, maximum out of pocket, annual drug costs based on what we put here. Our star ratings, as you can see, 3.5 out of 5 stars for this new year. That was an increase over last year. And then we have the difference between this plan. We have the prime time here. And then we could also see our PPO, which is our local PPO, which we are at 4 out of 5 stars. And then we have our regional PPO at 3.5 stars. And you can see the fluctuation of the drug costs. And now we're going to address medical services. For this demonstration, what we're going to do is we're going to look at the lifetime, and that way we can see those costs for the lifetime drugs. Once I click on that, I'm going to be brought over to the plan details page, and in the plan details page, these are tabs on the top. If we were looking at the drug costs and coverage, because that was something that was important to the client, we would then click on here, scroll down, and we could see the cost of using Walgreens, we could see the cost of using CVS, or we could use the cost of using the mail order. As we move our eyes down, you can see the cost of each particular drug. One thing that's very important when you're looking at our formulary, you remember and keep in mind, very important, that our formulary tier listing is going to show the maximum collectible amount for that particular medication. So if the chain pharmacy or the full cost of the drug that is being charged from the pharmacy is less than that tier, then you would pay less than that tier. So for example, if it was showing as a tier 4 for $85, but it's a $12 medication, you will simply only pay $12. So that's where it becomes important for you to reference this guide, to look at this list and be able to manage the cost of those medications. So as you can see here, the hydrocodone, full cost of the drug is $71.62. In the initial coverage of our Florida Blue HMO policy, the lifetime that we're looking at here, you can see they would pay $71.62 for that particular medication. You can see the cost of the Synthroid generic would be $0. The real cost is $576, but the initial coverage level cost is going to be $0, as well as the metformin at $0. So the pain medication that this particular client is going to be the full cost of the drug based on the number and the dosage. If we come down a little bit further, we'll see how this is affecting the donut hole and how we're getting and gaining towards that donut hole, because there would be a fluctuation in monthly costs and drug costs if we hit the donut hole. If we come back up, we can hit the plus button here if we wanted to look at some more details. And as we're looking at some of these details, you can really see overall what we're going to end up paying some more. Here's the full cost of the drug, so we know that this is what's getting us to that donut hole, because you're always going to want to select the lower cost pharmacies to help avoid some of those donut hole areas. All right, so as we come down here as well, we can see these different costs as we're affected in CVS, Walgreens, or as well mail order. So you can see the overall cost that your clients are going to pay. That also changes when you click on the tabs here. So at that, we've kind of gone through how this works, but let's just touch on health benefits. You always want to reference your summary of benefits for all details, and that's listed here. And as well as that, we can see star ratings, star rating explanations overall, and then our medication therapy management programs. This is something that is new for this year. So that really gets us all of the information. You can remember here that you have to note your identification number for the drug list ID, as well as the password date, so that way you can access this at a later time. That should cover using Medicare.gov. You need to make sure that you're accessing this on a regular basis. It's a great service that you need to provide to all of your clients to make sure they're understanding the overall costs. Alright everybody, now what we're going to do is we are going to show you how to retrieve that drug list that we just created. So it's really good if you can create that, but if you don't know how to look it up and to find it, then it doesn't really do you much good. So you're going to click on Find Health and Drug Plans. Again, we're starting at Medicare.gov. We want to enter in the same zip code that you started with when you did your setup of the other program. So whatever the zip code that's listed on your ID for that you recorded in our last training, then you're going to want to follow that same zip code. Again, you're going to do I don't know and I don't know here. You're going to continue to plan results. Let's get rid of that. Now what's going to happen, scan your eyes down. You'll see here we can put in a drug list ID. I'm going to enter the drug list ID from earlier. We're going to put that date in because that date was 10/14/2013, and we're going to retrieve my drug list. Instead of me having to enter in all that information all over again, I just simply type that little bit of information in here. Those of you that saw before and were paying attention, the same medications are listed here. I can add to this list as well if need to, or make any of the appropriate changes. But it really will expedite the process of you assisting your customers and helping your customers understand that you're doing your due diligence to make sure that you're identifying the real costs. Well, thank you. I hope everybody enjoyed this training.